Thanks so much for tuning in this earnings conversation with Ameera Shah of Metropolis. By the standards that they set for themselves in performance and and conversations at the end of quarters, I guess a few quarters of the street would have been disappointed with the compared to the expectations that the street had. Let's get ready to try and understand what went behind quarter one and how could the quarters ahead shape up. Ameera, great having you. Thanks for joining in, and I hope all is well. Uh, I understand that the COVID revenues were gonna slip off, and they have. But was the 26 odd percent growth in non-COVID in line with expectations, or would you have hoped for better?
I don't know why, but analysts always seem to expect a very large amount from Metropolis compared to the peers. Actually, if you look at the benchmark of the listed peers, we have done better than both. If you look at some of our unlisted peers, we have also done better. So overall, I think our 26% year-on-year non-COVID growth has been very positive. For some reason, there was analyst expectations of much higher. I think some of that is a misunderstanding of the industry because Q4 was actually a strong quarter for Metropolis, which it wasn't for other peers. And there's always an assumption of Q-on-Q growth, which actually is an incorrect assumption in our industry, because people don't fall sick quarter on quarter just because we think they should. People fall sick based on weather, based on their travel, based on their lifestyle. And since we are strong in the west and south of India, in those markets of India, actually Q4 and Q2 are the strongest quarters from an illness perspective. And Q1 is always the weakest quarter for us, traditionally and historically. So frankly, we have done much better in Q1 than we expected. We've actually seen a quarter-on-quarter growth from Q4 to Q1, which traditionally never happens. So we actually think we're on the right track and things are moving well.
Did I hear you say that since quarter two is going to be seasonally a strong quarter? I don't want to compare it QOQ, but I'm just asking you, since that has happened, you reckon you can improve upon what you've done on the non-COVID side in quarter two or quarter one as well?
That's right. If you look at our historical trends, Q2 is always higher than Q1, but Q1 is always lower than Q4. But this year, Q1 has been higher than Q4 on non-COVID, and we do expect Q2 to be higher than Q1 on non-COVID.
Okay. Some metrics, Ameera, about realization per patient and volumes and some trends that you can give us, which maybe the street is missing?
Absolutely. In fact, one of the strongest things about Metropolis always has been that our revenue per patient has been highest in the industry. And that is really a reflection of the quality of the business. We go to the top-notch doctors of India, which are mostly specialists, nephrologists, neurologists, cardiologists, oncologists, and they refer to us patients who require specialized testing. And that's the reason why our revenue per patient is the highest in the industry. And that has increased again 3% year on year. Currently, it is 955 per test, which includes COVID. If you exclude COVID, it'll actually be closer to 975 or something per patient. So actually, this is a metric which is moving up for us quite well, and something that we hope to continue to focus
on. Okay. Now, in quarter four, or when we spoke in fourth quarter, or when we analyzed the numbers in the fourth quarter, investments in the leadership team, front-ending, investments in labs, etc., had led to margin performance the way it was. Are the same reasons holding true for the margin performance in quarter one as well?
No, actually Q1 being usually a lower revenue quarter, our business is an economies of scale business. So the minute you do see revenues come down on a quarterly basis, obviously margins will come down. And again, that is historical. You look at the last 5 years of Metropolis, it's the same trend. Usually Q1, because of slightly lower revenues, will show a slightly lower EBITDA margin. And then when the volumes go up in Q2, we see the margins improve again. So always Q2 and Q4, highest revenue, highest margins. Q1, Q3, lowest revenue, lowest margins.
I'll remember this at the end of the quarter two conversation, Ameera. A couple of things. One thing where I thought I saw a bit of a dichotomy, and please correct me if I'm wrong. You've mentioned that your B2C contribution continues to increase, but when I look at it, compared to FY22, it's largely been stable at around the 60% mark, right? Or am I missing something?
No, last year it was 58% in Q1, and it is now 60%. And we count this B2C contribution as a part of our focus cities, which are the 5 cities in which we are building B2C. So there has been an improvement. There has been a 28% year-on-year increase in B2C for the non-COVID piece. So the B2C for the last 5 years has been growing well for us. And this is something that we continue to see. And we've even built more distribution in our core markets. So for example, just in Bombay alone, we're building 150 new centers this year. In Chennai, we've built, so in all our core markets, we are deepening the density of collection centers in these markets, because we believe that we continue to be leaders in these markets and we can continue to grow and have a runway.
When it comes to labs, Rishin, 6 in Q1, you were targeted about, if I'm not wrong, 30 for the year. You speed that up, or do you moderate it down a little bit?
So we had actually planned about 90 labs by FY25, which is approximately 20 labs per year. So we do estimate that we'll get to approximately that kind of number. We are on track as far as our plan of 90 labs and 1,800 centers.
Okay, so circa 20 labs for FY23, out of which 6 have been done. You probably add another 14, 15 for the rest of the year.
That's right.
Okay, great. Last couple of questions. One is on leadership. One is on how do you see this going ahead? Because there's the dichotomy around how this business will shape up over the next few years is pretty interesting. Would want your view before I let you go. But first, the change in leadership. I know Vijender Singh stays on, I presume, till 30th November. But you mentioned at the end of the last quarter that you are front-ending a lot of leadership and increasing investments there. Is there, for lack of a better word, a possibility of a vacuum, or you reckon that will not be the case?
Look, I've been building this business for the past 20 years. And, I've had different professionals at different points partnering with me on the execution piece of it at different stages. We have a very strong round of CXO leaders who are completely, there is no gap there at all. We have the entire suite of CXO leaders who are responsible for the P&L and the operations of the business under my guidance. I don't expect there to be any gap for the year. And like I said, that we will be announcing the new CEO's name shortly. Okay, great. One last question, Ameera. And the street is divided right down the middle. It'll still be even after your answer, but I'm still trying to understand. With all this conversation around cheaper tests available, not just from unreputed brands, but from reputed brands as well, does it kind of dent margin possibilities or revenue possibilities going ahead? Or do you reckon this will remain a traditional brick and mortar led industry for the years to come? What's your sense? I don't think it's a this or that. I think markets evolve, industries evolve. But I think the fundamental thing to understand is that the question is, who are you asking about reputed brands, right? If you go and ask doctors, are these reputed brands? The doctors will say no, because they may be reputed in another industry, but they're not reputed in diagnostics, right? So even the top hospital players, when they enter diagnostics, it doesn't mean that doctors automatically start referring because they trust the hospitals for treatment. They trust pathology experts for diagnostics. They trust eye experts for eye care. They trust dental experts for dentistry. These are all subspecialties in healthcare, and the doctors understand the differences. It is the consumer who assumes that, if somebody is very good at making XYZ product, that brand translates to diagnostics, and there must be a well-known established brand. But the consumer, the only market and the segment that the consumer is making a decision on is actually the wellness segment, where the consumer decides to get a package done and they decide where to get it done. But if you look on the illness segment, when somebody falls sick, they go to a doctor, and the doctor usually recommends where to get the test done, especially if it's an important test, which is going to determine the course of their treatment and their surgery. The patient is not the one, the consumer is not the one taking the decisions at that point. So consumer behavior and decision-making is very different in the wellness segment and very different in the illness segment. So to your question, I think some of the new competitors can make a mark in the wellness segment, which also they are trying to make a mark in very low price segment, which frankly is economically not viable, but they may do it for their own reasons. But for them to translate that to trust and credibility in the illness segment is a completely different hypothesis. And I don't think we should confuse them. And I'm guessing from your answer, just a final follow-up,
that growth in the illness segment, considering that organized is still just about 15-16%. So growth in the illness segment plus market share gains alone, even if that were to play out, leaves you enough headroom for growth for the foreseeable future.
Absolutely. I mean, our strategy is to continue to build in the illness side as we have been doing, but to do it even better and more aggressively than we've been doing in the past. But along with that, it also, COVID and the new health tech players have opened up the wellness segment for the industry. If you see our wellness, which was a 7% component about a year ago, has now become a 12% contribution of our entire mix. So wellness is a very fast growing, and it's grown at 98% for us year on year. So wellness is a very fast growing category. And this we expect will continue to grow in the years to come. So we now have not only the illness category, but the wellness and the chronic side. So we've actually got 3 segments to focus on, which is actually a great new opportunity for companies like Metropolis, which were not there.
Well, due to paucity of time, I won't probe that more this time, but the next quarter we'll talk about that and talk about the uptick in performance that would normally come with quarter 2 as well.
Sure. Look forward.
Thanks, Ameera. Appreciate. All the best.
Bye.
Viewers, thanks for tuning in.
Thank you.